Well, fallopian tubes are fundamental to achieve a normal pregnancy or a pregnancy with an artificial insemination, because they're like pipes that connect the ovaries to the uterus. So they let the oocyte that is ovulated from the ovary to enter through the uterus and to meet the spermatozoa, who is climbing from the uterus to the fallopian tube. So in this case, they let the fertilisation. If we have no fallopian tubes, it is impossible that the spermatozoa reach the oocyte. So we need to perform an IVF. We can have a lot of causes. I think the most frequent are adhesions, so from infections, from pelvic infections, or from endometriosis, for example. So these are pathologies that causes inflammation in the pelvis, so some scars, some adhesion that can block the tubes, and so they can close them. We have a lot of other causes that are very rare, like agenesia. Some women can be birthed without the fallopian tubes, for example, or they cannot function properly. But I think the two most important causes are endometriosis and infections. We can use some diagnostic tests like hysterosalpingography or hysterosonography, and they consist in putting some contrast medium in the uterus with a certain pressure. So we can push this medium, the liquid, through the uterus and the fallopian tubes to the pelvis. And in this moment, we can perform an ultrasound scan or a radiography and see that the contrast medium comes out from the tubes and goes to the pelvis. So in this case, we can say that the fallopian tubes are open. If we cannot see that the medium passes to the pelvis, it remains in the uterus or in the first part of the tubes, so we can say that they are closed. It is very difficult. In some cases, we have just a small light occlusion, so with the pressure of the contrast medium that we use to do the hysterosalpingography, for example, we can open them. But in some cases, it's not possible. We can try sometimes with surgery, with microsurgery, but it's a very complicated one. And in the most cases, it produces some scars that will close again the tubes. Yes, certainly. It won't be a natural pregnancy. We need to perform an IVF, an in vitro fertilization, so we can retrieve the oocyte, fertilize them with the sperm in the laboratory. We can develop the embryos, select the embryo we want to transfer, and put it in the uterus. So in this case, the embryo is fertilized. It stays in the uterus where it has to implant, and we don't need the fallopian tubes.